Hello and welcome to Healthcare Unfiltered. Today I'm joined by Dr. Manmohan Singh, who is the Vice Chairperson, Neurosurgery at Paras Health Program. Thank you so much, sir. Thank you for your time.
Hello.
Thank you for joining us.
Thank you.
So to start with, I would really like to know that pain is, one of the main reasons that we should be active about it and, we should consider it seriously. But what about headaches? Like people often, consider headaches as, harmless. And what should be that sign or maybe the condition that we should take the headache seriously?
Yeah, exactly. So as in cases of spine, that headache is also a very important symptom which we should not ignore. So most of the headaches which we probably every one of us will experience in everyday life. So usually these headaches are very mild and usually can be there for an hour or so or maybe a few hours and they can disappear and they never to come back again. So a headache which is occurring at regular intervals or which is not going despite treatment and it is continuing. So that headache we must be careful about it and must report to our treating physician. So I would now enumerate few other things along with the headache which we must not ignore. A headache which has occurred suddenly, like you are absolutely normal and the headache comes out of the blue. So that headache should always be considered serious and we must report. And these headaches, what it can be, sometimes it may be related to our hemorrhage in the brain. So even sometimes a very small hemorrhage in the brain which can lead to a sudden headache and it disappears. So that may be a warning sign and that can come back again with a serious hemorrhage at a later time. So if a headache occurs suddenly and it is out of the blue and it is so severe that you are not tolerating it, you must take action immediately and report to your nearest neurologist or the neurosurgeon. So that is important. Another thing is that along with the headache which is persistent and it is continuing and despite your day-to-day routine medication it is not going, that may be an ominous sign of some harboring other condition like brain tumors. So these headaches will never be completely treated or cured with that routine medication like aspirin or maybe paracetamol or other headache medications. So you should not be treating yourself with that. Again, you report to that. If an headache is associated with your visual decline, so that is also an important sign of the harboring a brain tumor. So in other nutshell, I would say that what are the signs and symptoms of the brain tumors? What are those? Usually a brain tumor is that uncontrolled growth of the cells in the brain which will keep on increasing and taking its size over a period of time. It will lead to the compression of the brain and will lead to the rise in intracranial pressure or the pressure in the brain increases. So it will lead to the chronic unrelenting headaches. It will lead to that reduction in that one's vision and patient can have vomiting also. So a headache associated with visual decline and off and on vomiting, especially in the morning time vomitings, it may be a sign of harboring a brain tumor. So if these symptoms are there, please do not ignore. These are the warning signs. Must go to your doctor and get yourself evaluated. So apart from that, along with the headache, what are the other signs of important or the ominous condition in the brain is like developing again a weakness in the one part of the body or maybe a speech difficulty, speech arrest. These are again an important signs of that brain condition that may be a part of the stroke or maybe harboring some sort of brain tumor. So these are the conditions you should never ignore.
Right. Sir, usually when we have headaches, people, there is one section of the society who considers that, you take a paracetamol and you will be fine with it or have chai or something. And the other section of the society is like that you should not take any kind of medicine for headaches and it will go eventually. So, what is the difference and what should be the actual, first step to that?
See, as I have told you that the headaches is a part and parcel of our everyday life. Somebody
Right.
will have headache one day or another day, but these headaches are usually self-limiting. So most of the time with the routine medication or taking rest or maybe sometime taking a tea or coffee, or maybe somebody may say that I get better with the offer, this is fine. But the headaches which I have told you that which is not getting relieved with your routine medications, you should always seek consultation from your doctor so that they can diagnose you that you are not harboring an ominous condition in the brain. So that a negative evaluation or your CT or MRI scan is good for you so that you know that there is nothing abnormal. So, but if you should not miss a treatable condition which is in its early stage,
Right.
that is important.
So is it fine to take like routine medicines if you're, if you're having a headache too?
So that is not a problem. You can always start with routine medication, but if you are not getting relief with that
Right.
and it is persisting, so then you must seek advice.
Right. Sir, since you also talked about the, spinal problems that, working professionals are having, and, since the job nature is such that they're sitting for, hours and hours on the laptop and, in the same posture. So throw some light on that also, as we see a trend of, increasing spinal conditions among the youth especially. Is wrong posture or sitting for, long hours is the only reason for spinal conditions, or there is more to it?
Yes, so it is that a wrong posture is the important thing. So that is very important and we should not ignore that. Another thing is that lack of strengthening exercises. So because we are not working out, God has not created us to sit. So thing is that we are ignoring that. We are not working out. Because of the lack of workout, we are developing weak neck, weak back, and that leads to the wrong posture. Again, because of the neck, weak muscles of that spine will lead to persistent deterioration of the posture of the spine, which lead to the further degeneration. So that if we know that our job is such that we are likely to sit for longer hours, we should devise our lifestyle in such a way that we should find time to work out. We strengthen our back, do daily exercises for that, and then go to your work. And it will definitely prevent your further deterioration in the spinal condition, and it will even cure many times early degenerative spine condition.
So there has been, many advancements in the neurological procedures. If I compare the procedures that were there in the country earlier and now, since AI is also there and robotic systems are also there in the process. What are your thoughts on that, and what is the current, scenario in the country?
So I would like to tell our audience that India is one of those countries in the world which have made the progress in both in leaps and bounds in neurosurgical practice. So in our country, I am very happy to state that we have all the infrastructure in majority of that hospital throughout the country, so that we can treat all brain and spinal condition which is at par with all developed countries. So there is no dearth of equipment and technology as well as the talent in our country, so that we should be very proud of that. And if there is a problem, we should immediately seek treatment at an appropriate place, so that we can get the treatment at the earliest, so that we can have a very good outcome.
Right. And how safe are these, advanced procedures, sir?
All neurosurgical procedures, they are quite advanced. We are using all sort of latest technology like neuromonitoring, image guidance surgeries. We have state-of-the-art endoscopic procedure, microscope, and whatnot we have. So that the surgery has become extremely safe, and the good outcome is usually the norm. So that even if that complex neurosurgical situation is there, both in brain and spine, so the outcome is very good nowadays.
There is this buzzword that's there in the country when we talk about healthcare, and that's minimal invasion techniques.
Yes.
So what are your thoughts on that?
So minimal invasion technique is again a modern thought, and it is there in our society for the, I would say, that past 2 decades. So it has advanced now. The very advanced minimally invasive techniques are there, which are so that we have to cut open the both brain and spine at the very small area. So you don't have have to go ahead with that conventional big operation so that patient is in the hospital for longer times. So both in spine, even the bigger spinal fixation which require putting up the screw and rods, that can't be easily done with the minimal invasive techniques, so that we don't have to cut open the spine in a long incisions. Same thing is true for the brain. So the minimal invasive techniques are there, endoscopic techniques are there, so that we don't have to cut open the brain and spine, so that a good outcome is there, patient's hospital stay is minimal, and the good outcome is usually ensured. But I would like to add a few lines here again. So all brain and spine conditions are many times not suitable for minimal invasive techniques. So many times people go to the internet or go to some sort of their own acquaintances that I just want a minimal invasive. So my advice to those patients are there, all brain and spine conditions are not suitable. So where it is not suitable, it is better to go ahead with that open procedures, so that your life is more important, your deficits are more important, rather than going ahead with the minimal invasive techniques. So it is a doctor or the surgeon will decide that which is suitable for you, which is better for your health. So that patient should not take a call for that I only want this. So otherwise there may be a suboptimal treatment you may be receiving. So let the doctor decide that which is good for you.
Thank you so much for your time, sir. I think this was really helpful to, burst the common myths, misconceptions that are there among the patients. Thank you so much.
Thank you, ma'am.
Thank you.
Thank you.
Thank you.